Good evening, guys. Today we are here with Dr. Dinesh, famous and upcoming orthopedic surgeon, and he's representing us on our channel AtMed. Our channel is primarily for all healthcare tips and news feeds, and we want to promote youngsters and young doctors in our channel and give them a chance for exposure of their skills. And likewise, yes.
Hi.
Dinesh, yeah.
So my name is Dr. Dinesh Chaudhary. So I'm an orthopedic surgeon with a special area of interest is sports injuries. So I specialize in arthroscopy. There is keyhole surgeries for any ligament injuries and joint replacements with a special interest in robotic joint replacements. And I was primarily trained here in Chennai. I did my UG. I'm actually a UG batchmate. UG meaning med school. I went to med school together with Dr. Suresh, and then did my post graduation. And then I worked here, and my specialization, my training was done in Sydney, Australia, and Spain and Italy.
So I'm just going to ask you a few questions, Dinesh. These are like, I'd say the basic doubts what patients have when they come to an orthopedic surgeon. The first few. So let's start with the most fundamental one, which is back pain, right? So what would you say in today's generation? Let's say leave the older people. Let's say the youngsters nowadays. All the youngsters who are like in their 20s also are coming with back pain, and then they're not able to identify whether it's actually muscular, or they actually Google everything and then they say I have numbness in my hands, I have numbness here, so it could be something related.
Most common is they come with sciatica.
Yes.
They self-diagnose themselves and they say, Doctor, I have sciatica. They don't say even back pain. They say no sciatica.
Oh, they're coming saying.
Yeah.
So could you tell me, like, have you seen this in youngsters of late? Like, what age group have you seen this?
So you're saying youngsters, 20 years.
Yeah.
I've had even school children coming in saying they have back pain.
You're serious?
Yeah, not back pain. I have sciatica. I have back pain. I have sciatica.
And what have you identified that? Has it been a legitimate diagnosis, or was there something else going on?
90% of back pain. Okay. There is some pathology, but 90% of back pain we term it as mechanical back pain. It's due to posture issues.
Fine.
Due to a muscle imbalance.
Okay.
You see the spine, it's surrounded by a bunch of muscles.
Okay.
Behind the spine, we have the spinal muscles. And in front, we have the core, the abdominal muscles.
Yes.
The weakness of the core is the most important cause of back pain these days.
Okay.
Yeah.
So I'm sorry I'm interrupting in this. I wanted you to bring that in place. So let's leave the back. We're saying the core is an issue also, right? So this is actually a first. Let's try and educate people on if one of the causes for back pain being a weak core.
Weak core.
So it's actually the front, which is going to cause pain in the back. Yes. So why don't we elaborate on that a little bit?
So when the front of your torso, the trunk, the abdominal muscles, when this is weak, the stress is more on the back. So that results in increased load on the spinal muscles and also the spinal bones and the structures surrounding the spinal bones. So this causes increased load on the back, on the spine, and this can cause back pain.
Okay. So you'd say, how do we strengthen this core of ours?
Strengthening, getting a six-pack. The simple question, simple answer.
We don't need that, right?
Yeah, you don't need that. So just strengthening by tightening your core, abdominal muscles, abdominal muscles, doing a lot of ab workouts, Ironman exercises, planks, Superman exercises. These all strengthen your core, and also some simple basic exercises for the spine.
Okay.
But the most important is preventing this muscle imbalance.
Fine.
Maintaining a proper posture, especially when you're sitting. People, I see this back pain in people who sit for a long period of time. IT industries, even school children, they are made to sit for long periods of time in school. So maintaining proper posture while sitting, taking frequent breaks, at least taking a break 1 hour, 45 minutes to 1 hour, going for a walk, going for a stroll, or stretching yourself. This can help in preventing back pain.
Is my posture okay?
It's good. Your core is excellent.
Okay, that's good.
There's no doubt about it.
So now you're saying, can this become serious? Like suppose they've had a prolonged period in, a sedentary lifestyle, they're young and they've been sitting and watching the computer, or even your cervical spine gets problems when you just keep looking at the phone, that, right? So for prolonged periods of time, can this become serious later on?
Yeah, so a bad posture, if ignored for a long period of time, this can lead to arthritis in the spine. It's known as spondylitis.
Okay.
When it happens in the lower back, it's known as lumbar spondylitis.
Okay.
When it happens in the neck, it's known as cervical spondylitis. And
Okay.
this can have a lot of bad effects as you age if you keep ignoring it.
So you're saying the youngsters, have you seen youngsters come with this
Yeah, I thought even
spondylitis?
school children, they come.
Okay.
No, not with spondylitis.
Not with- yeah.
Maybe the youngest, maybe 30, 35. That's when this
Okay.
actually starts to set in.
So I'd say in our parents' time, this wouldn't have happened at 30, 35, right? But now it's happening.
Yeah.
So, yeah, so we'd have to be a little careful.
Maybe our parents never had to sit in front of a computer for a long time. They were
Okay.
always having an active lifestyle.
Exactly.
The sedentary lifestyle has increased now.
Okay. Fine. So that's quite an eye opener that it's not just the back which is a problem,
The
but
core,
it's
yeah,
the
the front
core.
also, yeah.
That makes sense. Yeah. So what else would the advice you would like to convey to such patients when they come? Would you say like first wait it out, try and focus on fitness, and then come and see a doctor, or would you say
Okay.
go and see them immediately if you have back pain?
Okay.
What are the alarming signals?
As a patient, it's very difficult for you to say if the back pain is because of the posture or if there's some underlying pathology inside.
Okay.
So as I told you, 90% of the back pain is mechanical back pain. But there's another 10% where there might be some pathology inside. Where
Okay.
pathology meaning there might be a disc prolapse. You might not know. When a disc prolapse happens, that is, a disc is a soft cartilage-like tissue that is present between the different vertebra. All the vertebrae have a cartilage-like tissue in between called the disc. It's like it acts like a shock absorber. Sometimes what happens is a disc might bulge out or it might prolapse from its place and impinge on the nerve root.
Okay.
When this happens, that's when the sciatica happens. They have pain radiating along the legs, along the thighs.
Okay.
It's like a current type of pain along with numbness and all that. So this can happen. There might be slip of the vertebra when one vertebra slips over the another.
Okay.
This is called spondylolisthesis. This is the medical terminology. Sorry for using a lot of medical
No,
terms.
you should. I mean,
This is known as spondylolisthesis, where one vertebra slips over the other. Or there might be some tumor in the spine, like tuberculosis of the spine, or there can be some lesions in the spine. We don't know. So that a patient, as such, they don't know what this is. So if they come check with the doctor, any orthopedic surgeon or even a general doctor,
Fine.
they will be able to figure out whether this is actually a mechanical back pain or if there's any pathology inside, and they'll be able to give you the correct course of treatment.
Okay, sounds like good advice. And I'd also want you to just give a few pointers for people who are lifting weights. Now, how many cases of disc prolapse have you seen with a person who's been lifting weights for a long time in comparison to a person who's just started working out? And what, like I said, at that moment, suppose something has happened in the gym and he has a disc prolapse or something, they might feel it. They feel a sound and then they get scared and they can't even move sometimes, right? What will be the first advice you would tell them on first aid? Don't put them in this position when they have to rush to the hospital, for example. I've seen one person go through that kind of condition and I've seen another person's shoulder dislocate. So at that time, they really didn't know what to do. They're trying to put the shoulder back in. They're trying to do manipulation, right? So what can you say that you could avoid that time and to transport the person from point A to point B, which is the hospital, safely?
Okay, I think there are two questions here. One is disc prolapse and then what you have to do.
Yes.
Okay, in case of a disc prolapse, you asked me disc prolapse, who does it happen with? Whether it happens with people who are lifting for a long period of time or people who start lifting immediately. Yes. Okay, the answer for this is it doesn't have any relation to do with the amount of weight you're lifting or the time of period of weight that you're lifting with.
Okay.
The most important cause for a disc prolapse is bad posture. When you lift a weight in a bad posture, that weight can even be just 5 kilos or even can just be a piece of paper.
Okay.
When you do it in the wrong way, when you stretch your spine in the wrong way, the disc prolapse can happen. Or if you're having pre-existingly, your muscles are not strong enough, your posture is not right, your abdominal muscles, your core, your spine muscles are not strong enough. Okay. It can happen with just 2 kilos of weight. So you might be a very seasoned bodybuilder. For example, Ronnie Coleman, he had a disc bulge. He had it. He is a seasoned bodybuilder. He's been lifting. He's been squatting 200 pounds, 300 pounds regularly. The mistake that he did was for 2 weeks he didn't train.
Okay.
He used to lift 500 pounds, 600 pounds. So for 2 weeks he didn't train. And after the gap of 2 weeks, he started training in the same weight, 600 pounds. His disc bulged.
Okay.
Yeah. So that's the mistake that Ronnie Coleman did.
Okay.
If this can happen to Ronnie Coleman, it can happen to any of us. So we have to be very, very careful whatever workout we do, proper warm-ups and take it up gradually. And our posture, very, very careful with the posture.
Okay.
Just because we have been squatting for the past 20 years, there's no guarantee that we will not make a mistake.
Okay.
So each time you squat, make sure, keep in your mind like this is the first time you're squatting.
Fine. And I'm going to close this with the last question on back pain, and it's related to the gym again. So there is some myth. Some people say you don't have to wear a belt. Some people say you have to wear a belt. I mean, my theory would be if you're obviously loading on the back, I mean like a deadlift or something, I would wear a belt even if it's going to give me 10% of safety, right? But then some people are totally against it. Then you see the other extreme. They wear a belt for everything. They wear a belt when they're using the upper body. They wear a belt when they're whatever, like even if they're lifting lightweight. So what's the balance in this?
See, always wearing a belt can weaken your core.
Oh, okay.
It's a fact, yeah. I'm not saying you should not wear a belt at all. Sometimes when you go heavy, I mean, you start off, you do a warm-ups, you start off your first set, second set, third set. Your final set may be the heaviest. Wear a belt at the final set. Don't start wearing a belt for your warm-ups. Okay. Don't start wearing a belt when you are starting off. Always the best way to go, for me personally, don't wear a belt. Okay. But when you're going heavy, the heavier you go, maybe the last 2 sets, wear a belt for that.
Fine. Okay, that makes sense.
Yeah. Because if you used to wearing a belt all the time, that will weaken your core. Your core will not be acting. Especially when you do squats and deadlifts, you're not doing it only for your back or your thighs. You're going to work out your core as well when you're doing your squats. When you're doing a deadlifts also, your core is going to be working out. So if you wear a belt, you're preventing your core from working out its maximum.
Okay.
So you lose out on that.
Nice. Okay. So I hope, I mean, that seemed pretty helpful for us. Now, you know, when we're talking about Ronnie Coleman, right? I mean, I have framed a few questions for you. And there is something which, there is something which I want to bring to topic about, you know, bodybuilding in general. I mean, it could be a little bit of a taboo subject, but from what I know and my knowledge on this is, I feel that also beyond all of the improper form and the injuries, I feel that steroids do play a bit of a factor where they say the muscles suddenly become really big and strong, but your ligaments and tendons are not following through on this. Now, when you come off the steroids, I mean, I feel like people should be educated on this. You know, I respect every athlete who's into the field, and if they're going on stage, it's a big thing. Okay, I know my friends who have done it, few other people, personally, I've also done whatever. But we have to educate them on the safeties and how to be careful later on in life. So my understanding is that after they finish their course on, you know, whatever enhancement supplements they're taking, they begin to get a little bit of osteoporosis, I've heard. And then I heard that on the hip joint, they get avascular necrosis in a later date. When they're 50s, 45, it starts, that onset starts. I think the first warning symptom, I just want to know whether it is tight groins, like a groin pain, and then it progresses further and further. And I feel that even Ronnie Coleman or some bodybuilders like him, they had to go through replacement surgeries, and could be due to the anabolic steroids, right? So where is the balance? What advice could you give for a professional athlete? Where to be careful with this?
So all these effects, the side effects that told, you know, hip avascular necrosis, and then what else did you say?
Osteoporosis. So could you tell them, like, you know, could you tell people, we know what avascular necrosis is. We've read about it, right? But could you tell it in a person who doesn't know about the subject medicine?
So avascular necrosis meaning it's there in the name itself. Avascular. So there's no vascularity. The blood supply is lost for the hip bone, and necrosis is dead bone. So because of the loss of blood supply, the hip bone becomes dead. So there's no blood supply. So there's severe pain. The hip goes into arthritis. So that results in joint replacements. So this is most commonly seen as a side effect of not just steroids is of 2 types. One is generally doctors prescribe the corticosteroids. Okay. This is to reduce the immunity, to reduce the inflammation. They give it even for some pain, some inflammatory conditions, lot of rheumatoid conditions. Doctors, we regularly prescribe corticosteroids. The next is the anabolic steroids. So anabolic steroids are synthetic versions of testosterone, different synthetic versions of testosterone, which is used by a lot of athletes and even bodybuilders to increase the muscle mass.
Yes.
Okay. So one side effect of using steroids, even corticosteroids, is avascular necrosis. We don't know who it comes to. I've seen people who have been using even not anabolics, even corticosteroids,
Okay.
long periods of time, they haven't got it. Some people just use it for a week and they get avascular necrosis.
Serious,
So
okay.
we don't know who gets it or
Okay.
who doesn't get it. Maybe it's prone for genetics as well.
Okay.
So even anabolics, I've seen so many bodybuilders, athletes even, they're using anabolics, they've been fine. And some people who just tried 1 dose, 2 dose, they get avian. We don't know.
Okay.
But one documented evidence is using steroids for a prolonged period of time will result in osteoporosis. So osteoporosis is weakening of the bones. The bone is supposed to be nice and thick and full of
Should be hard.
Hard. So the osteoporosis, the bone will become like a biscuit. It increases your risk of fractures very easily. You will get fractured very easily. So the risk of osteoporosis is high when you are using steroids for a long period of time.
Okay. You're saying a lengthy time.
Lengthy period of time.
Okay.
So if you know how to use it, you do it under a doctor's prescription, under guidance.
Yeah.
You get your bone scans done regularly, see the thickness of the bones, and then if your bones are weak, you need to take some supplements for that. Calcium supplements, some teriparatide, those supplements. If you can do that, then you can prevent these effects.
I mean, that's good advice, I feel, for bodybuilders and everything, because I'd say there are 2 things they need to check on. Like, one is the heart.
Yes.
For sure, but they're using anabolics, and we look at a genetic susceptibility, right? That is, if somebody has diabetes in the family, or somebody had a heart disease previously in the family, then I would say you have to think twice about taking this career choice with enhanced supplements. But if
not just people who are taking anabolics, people who are into fitness and active lifestyle athletes, I think you need to regularly check their blood pressures, your diabetes levels, your cholesterol levels, and your bone scans.
Bone scan, yeah. And do you feel that this is in direct correlation to the testosterone level, the blood testosterone level?
Yeah, when you are increasing testosterone levels beyond the normal ranges, that they can have these side effects.
These side effects, okay. So yeah, in regards to orthopedics, the same side effects what you'd have for enhanced supplements like testosterone, you're going to have the repercussions overall in your body. So that's what you mean to say, like it can be from your heart to your brain to everything, right? So, but the good answer over here, what we got is, he's saying, please consult your doctor. At least be safe.
Yes.
At least know where you're going. Nowadays, it's things are a little more open, and people are willing to hear a person out. They don't have to hide behind closed doors and take a risk. So that's a good takeaway from that question. Let's see what we have. That's a good one. So I've heard of you, arthritis is your bread and butter. You've heard about that term day in and day out. I have a question for you. I feel that people who are runners, long distance runners, are more prone to arthritis in comparison to people who are weightlifters or maybe sprinters. What do you feel on that? What's the takeaway on that, and could you give an explanation to the audience on that?
First, let me tell what arthritis means. Arthritis, Tamil we'll say moottu theimanam. So arthritis is, arthro means joint, and itis means inflammation. The joint is inflammation and degenerated. That's known as arthritis. Okay. So what evidence, you asked me whether runners are more prone for arthritis, knee arthritis, or bodybuilders, weightlifters are more prone for arthritis. So what we tend to think is, because runners, they are high impact activities, they are more prone for arthritis. But what evidence has shown is, there's no difference. If you have an injury, the biggest predictor for arthritis is pre-existing injury.
Okay.
So if you have injured your knee joint, the most common site of arthritis is knee, followed by the hip and then the shoulder. Yeah. So if you had an injury to your knee joint, whether ACL has been torn or there's some cartilage damage or a meniscus has been torn, if you're lifting weights with this injured knee, or if you're running with this injured knee, you're more prone for arthritis. If your knee is completely normal, then it doesn't matter when you run or whether you lift weights, you're not going to get arthritis, provided the muscles around the knee joint are strong. So you're just running, you're not strengthening your knee joint muscles, you are a little bit higher risk for arthritis. But if you strengthen the muscles around the knee joint, your quadriceps, your hamstrings, those things, then your risk of injury is very less.
Okay, this makes sense, because actually thinking of it, I've seen people who actually strengthen their the muscles, right? And they'll run, they sprint, they do a lot of things. Actually, I've not seen much of a problem with them. But likewise, when you said it's not only with long distance runners, and we used to wonder, some footballers will get grade 3 arthritis.
Yes, exactly. So footballers now what they're doing, they're incorporating the weight training program into the soccer players as well.
Okay.
So you have to strengthen your thigh. You have to see your thighs of a football player. They'll be massive.
That's crazy.
Calves, they'll be having very lean torso, but the thighs will be very thick. So you have to strengthen your thighs, your strengthen calf muscles.
Okay.
So the injuries while playing football is very less.
Okay.
Similarly, there are specific programs for a tennis player, for a shuttle player. They have to strengthen your shoulders, your elbows, so that you don't get injuries as easily.
So I have one more thing. Could you give me some good preventive supplements for arthritis? Like some, at least 10%. 10% is something, right? Or you feel there's nothing which is going to help? You don't think fish oil helps?
I feel the best prescription, best medicine is exercise.
Yeah.
So you want to prevent an injury, you have to exercise around it.
Okay.
So for a specific sport, there are specific exercises. So rather than taking supplements, you exercise, and there are specific set of exercise for football players, specific set of exercise for cricket players, for athletes I'm saying.
Yeah.
Even bodybuilders, before you start working out, there are certain simple exercises that you can do to prevent those injuries.
Okay. So you advocate more on that.
I advocate more on exercise.
Okay. There's a very common thing I've been seeing nowadays with a lot of patients, right? And it's called a fear of a knee surgery. Okay. So we wanted to demystify certain things around knee surgery and some success stories. I would also like to give people a chance, like, in the sense, how far can they take, arthritis to a stage where they don't need a knee replacement? Like, can they prolong this process and then see 10, maybe 5 years later? Or would you say, no, you see grade 2, grade 3 on the x-ray, you have to do this? Or can you say, can we try something like stem cells, PRP, and then move on to the next step?
Okay, for this question, there's first the main, I like to say, I like to quote Hippocrates, treat the patient, not the disease. Yes. So never treat the x-ray, never treat the blood test report. See what the patient has. Okay. I've seen people with grade 4 arthritis. I mean, there are 4 stages of arthritis. Yeah. One is the most starting stage, early arthritis. Yeah. And grade 4 is a very severe stage, full bone deformed. Yeah. I've seen, especially in the Indian population, the South Indian population, people with severe grade 4 varus arthritis, they'll be completely pain-free. They'll be squatting, they'll be doing all the farmers and all that. Yeah. So why do you want a knee replacement? Why do you want to replace the knees? What are you going to give them? Okay. So as far as a knee replacement, a replacement is concerned, especially a knee replacement, it is a life-modifying surgery. It is not a life-saving surgery. Right. So you're not saving this life. You're modifying the quality of life. Correct. So if you're not having pain, so what are you modifying? So it's up to the patient whether the patient wants a replacement or not. Okay. So you come to me if you cannot walk, if you're having pain while walking, if you're facing difficulties in daily activities of living, we call it DALI, the daily activities of living. Okay. If you have problem with this, if you say I'm having pain while sitting, I'm having pain while walking, I'm not able to walk, I'm not able to go for a walk, I'm not able to play my favorite sport, then you do a replacement. So you don't treat the knee, you don't treat the x-ray, you treat the patient. So that's my motto, that's what I've been following, and so far I think I've been successful.
That's really good. And what about the other options I was talking about, PRP, stem cells? What's your take on it?
They do work in early stages, stage 1, stage 2, stage 3, stage 4. I don't think there's any role for PRP or stem cells once the mechanical alignment is lost. When the mechanical alignment is intact, mechanical anatomic alignment is intact, then in stage 1 or stage 2, you can do this to postpone knee replacement. You asked about knee surgeries. What I'm saying is for replacement alone. Say the patient has an ACL tear. Patient has a meniscus tear, then there's no waiting. You have to get the surgery done.
You have to get it done,
Because if the meniscus ACL tear is the beginning of the end of the knee. That's a saying. It's like the heart attack of the knee. So what the ACL does, it's like a seat belt for the knee. So your seat belt is cut off. So you won't be having much pain or anything after ACL tear. You'll be fine. You'll be asking, doctor, why do I need this surgery? I don't have instability. I'm fine. Why should I get the surgery done?
I've seen many like that,
so they'll be doing the range, everything normally. Normally I can walk, I can jog. Why should I get the surgery done? So the ACL is like the seat belt for the knee. So when the ACL is torn, the stability for the knee is gone. So your knee starts slipping. So when your knee, that is the femur starts slipping over the tibia. So when the knee starts slipping, the cartilage starts to get degenerated. Your meniscus starts to get torn. So meniscus is like, so what you have like a disc for the vertebra, a shock absorber. Meniscus is like a shock absorber between the femur and the tibia. So when the meniscus gets torn, the femur and tibia starts to get rubbing against each other. So that's puts you for osteoarthritis.
Okay.
So usually osteoarthritis, you get the mutataimana, what you get in 50s, 60s, you start getting it in 30s itself.
Yeah, I've seen many like that.
Yeah, so you end up with a early knee replacement.
Yeah.
So if you're having a ACL tear or a meniscal tear or a ligament injury, it's best to get earliest intervention as possible.
Fine. And people are really scared. I mean, even if it's going to be they say
keyhole surgery,
yeah,
yes.
they say keyhole. But what is the actual recovery? Like how far? Like how many days? I'm not saying the surgery is over. I can get up and walk on crutches. That's not what I'm saying. I'm saying when can we actually get back to activities pain-free after keyhole? And that's just a general question for the.
The keyhole meaning arthroscopy. There are different surgeries that we can do. We can do an ACL reconstruction. The PCL can be torn. We can reconstruct the PCL. Meniscus can be torn. We can repair the meniscus or trim the meniscus. So if you're just trimming the meniscus, you will be pain-free within 3 or 4 days.
Okay.
With ACL, now we have very good pain specialists, pain management specialists. The anesthesia has advanced a lot. They are doing wonders.
Okay.
With ACL surgeries, probably 1 or 2 weeks, you'll be pain-free. You can do all your activities. But going back to sports, you have to wait for 1 year.
1 year?
If you're a sports player.
Okay.
So if you're a football player, you had a football injury, going back to sports will be at least 9 months.
Okay, fine.
Return to sports. We call it return to sports.
Okay.
We say at least 9 months.
Okay, fine.
So, but doing a normal activities, walking, running, even running, you can start within in 1 month.
Okay.
Yeah, but going back to sports, we have to wait for 1 year.
So, on a whole, what we've understood is orthopedics is just not only the surgeon, and it's also to do with the patient.
Yes.
Their mindset.
It's a teamwork. Yeah.
It's teamwork.
We have to work with the anesthetist. We have with the physiotherapist.
Physiotherapist is there. They're also a key component in this, and like you said, it's the patient's mindset also.
Exactly.
They have to be willing to work to get back to.
I've seen this. People do very well who have very good mindsets.
Exactly.
Yeah. Pre-operatively, before the surgery, the kind of mindset they are in. If you're like, I have to go back, I have to do this activity, do this sport, then they do very well.
You talk about medical miracles; those people have it, right?
Yes.
I mean, some of the doctors are really shocked. They'll be like, I expected you to recover within 10 days, but I've seen many people, they say within 7 days, 5 days. And you'd even see that mindset with the 80-year-old or 90-year-old also. It depends.
Yesterday, I did a knee replacement for an 80-year-old.
Yes.
He had diabetes, he had heart problems. The anesthetist was scaring me. He said, don't do the surgery. No. I did the surgery yesterday. 12 p.m. the surgery was over.
Okay.
6 p.m. he was walking.
Perfect.
And his knee, he was bending. The knee bending was 100 degrees. That's amazing.
Yeah.
Even pre-operatively, some people don't have that. So it depends on the mindset.
Yeah. This is a good one actually. I mean, this has been age old, right? Since the time I have been working out, since the time you have been working out, what's the right age to start gymming?
Okay. When we were small and all, people used to say you should not work out. It will stunt your growth.
Yeah, this is what I want to know.
Yeah, it will stunt your growth. But now evidence says there's no difference at all. Weightlifting does not stunt your growth. Okay, but there is a difference. There is a catch.
Okay.
If you want to lift weights for the purpose of building muscle, then you need to wait till you're 18 years old.
Why would you say that?
Because at a young age, the bones will be growing, the tendons, ligaments, there will be a mismatch between them. When you start putting pressure on the ligaments and tendons, that can cause a lot of pain. It's not going to stunt your growth, but it's going to cause you pain. So already, even without weightlifting, there will be some children with growing pains. We call the growing pains. They will be having tendinopathies, enthesopathies. So if you're going to load the tendons with the extra amount of weight, then that's going to cause them pain.
Okay. So I've heard one thing. I know. I mean, it's just what I heard. They'll say. I mean, the elders would be like, go do pull-ups, go and hang on a bar, go do funny stuff.
It will make you grow taller, right?
Yeah.
Evidence doesn't suggest that. So you can start lifting weight as early as 8 years old.
Fine.
But for strengthening purpose, not for building muscle. So you can't be loading weights. 8-year-old can't be squatting 50 kilos, 100 kilos. That's not advice. But if an 8-year-old is playing soccer, you can do strengthening exercises to improve to strengthen your knee joints so that you don't get injured.
Okay.
If a 10-year-old is doing tennis, you can lift weights specifically to improve your shoulder joint and elbow joint. So this can be done. So low weights, high reps, that can be done. But usually bodybuilders, when they start lifting weights, they lift weights, the primary aim of putting on muscle. That should wait till you're 18 years old.
Okay, I'll keep that in mind then. Have you heard of the new trend? I mean, it must be relevant to you. The ice bath for recovery. What is your take on it? What's the science behind it from your perspective? Do you feel it works?
So,
Or cryotherapy, I would say.
cryotherapy, yeah. So, people do it for recovery.
Okay.
If you personally ask me, the best recovery is sleep. 8 to 10 hours of sleep.
Yeah.
You can never beat that.
Yeah.
But if you want something beyond that, you can get an ice bath, but you have to remember, long-term recovery, it doesn't make any difference. That's what evidence says.
Okay.
But short-term recovery, say you're some restless or you're playing a sport, so you want to, you have, again after 6 hours, you have to again go back for a match, or you have to play the sport. In that cases, this will be helpful.
Okay.
Provided you don't do it frequently.
Why so?
It shows it's actually, if you're doing ice baths frequently, it's actually shown to reduce your gains. This is evidence.
Okay.
Yeah. So what evidence says is, if you do ice baths maybe once a month, it will increase your gains.
Okay.
It will make you recover, but that effect lasts only in the short-term recovery. When it comes to long-term, beyond 72 hours, it's shown not to make much difference.
Okay.
More of a placebo effect.
Okay. It's a good takeaway actually. I'll keep in mind. But could you tell me, I mean, from your perspective, the science behind the recovery part of the ice bath?
What it says is it cools. So what you do in a ice bath is you will be in about 5 to 15 degrees Celsius of temperature of water.
Okay.
Sometimes even 0 degrees, not beyond that.
Okay.
Temperature of water for about 10 minutes. So that cools down your body, cools down the muscles, and that increases your blood supply to the muscles. When the body is cooled down, it increases the blood supply to the muscles, so it will help in preventing this DOMS. They call it DOMS, delayed onset muscle soreness. So once you do this muscle workout or you play a sport, tennis sport, you'll be getting such muscle soreness. So that muscle soreness will be prevented by this.
Okay.
That's supposed to be the science behind it.
So because I'm going to get into this now. So what's your advice again? You said once a month, is it?
Once a month is advised, but don't do it frequently. Like maybe even once a week is fine, but not more than that.
Perfect.
3 times a week, 4 times a week, don't overdo it.
Okay. Yeah. So there's a topic I don't think which has been touched in, I feel so. People are not they've heard of the term blood cancer. Okay. They've heard of the term, stomach cancer or whatever, breast cancer. But I really feel that there should be a little more put into bone cancer. And people actually think, I think so, that it only comes for elderly, but there are scenarios where it comes for the young people also. Could you elaborate on this? And have you seen an increase in the patient influx with bone cancer?
First thing, fortunately, bone cancer is a bit of a rare phenomenon. Primary bone cancer. Statistically, it is less than 1% of all the cancers put together. That's a good news. Bad news is there is an increase in the incidence of bone cancer right now.
There is, okay.
I mean, compared to what?
Compared to before, okay.
But whatever said and done, primary bone cancer, the incidence is very, very, very less. Okay. It usually secondary, metastasis.
Yes.
Secondary meaning you get cancer, you have cancer in the lungs or the liver, and that spreads to other parts. Like bones. So that kind of cancer is a lot more than primary bone cancer. And primary bone cancer usually is genetic. There's a genetic predisposition, or it can be secondary to some radiation therapy that you've had. Radiation therapy, or some very rarely anabolic, some other drugs that you have taken as a side effect of that. Very, very rarely.
Okay. Yeah. So if you've seen metastasis, right?
Yes.
Like the metastasis is from your primary cancer, you get, metastasis to other organs and to the bone, for example.
Yes.
Now, can we treat that fast?
Yes.
If
identified quickly at the early stage, treatment is done. We can treat that fast.
Fast, right?
Yes.
In comparison to it going to an organ, I'm saying.
Yes.
So your prognosis is a little better, like on the bone, right?
Yes.
Okay. So when we think of tuberculosis, like TB, the first thing that comes to mind is it's in the lungs. They'll be coughing, or somebody, they'll have night sweats, fever, and that's it. That's the only thing people think of mostly, right? We rarely, probably the next thing we can go to is the organs like the stomach and all of that, right? But I'm sure not many people know about TB in the bones. Could you elaborate on that a bit?
Yeah. Like how, like we were talking about cancer and how it spreads to other bones, TB also can present in some bones.
Okay.
The most common will be the spine. And
The
that's,
spine,
Yeah,
okay.
spine. And that's known as POTS. That's a terminology also, POTS spine.
Okay.
POTTS, POTS spine.
Okay.
And it can also happen in the joints, tuberculous arthritis of the hip, of the knee,
my
of the
God.
ankle.
Okay.
Yeah, it can happen.
Okay.
Most common will be spine,
Okay.
followed by the hip, and then the knee.
But I've seen a lot of people miss it, right? Especially in orthopedics.
That's why I
What's the
said-
reason for that?
That's why I said whenever you have back pain, don't assume it's just mechanical. Even though 90% of the back pain, as I said, is just mechanical. I mean,
Yeah.
muscle issues, posture issues.
Okay.
It's always good to see a doctor, get an X-ray, and have it cleared, and then get your strengthening exercise, your protocol, your posture correction, all these things done.
Okay.
So that's why I told you visit the doctor.
So for the non-medicals, I just want you to educate them on this. Is it possible that with your blood workup you will be able to miss this if it's TB on the spine?
It's very difficult to get diagnosed TB of the spine or TB of the joints with just the blood workup.
Exactly.
You need to have an X-ray done, sometimes even an MRI or a CT scan to be done.
So the takeaway point is that's why they miss it out, because it will be hidden.
You don't get an X-ray
you
done,
don't-
yes.
Yeah, it will be hidden in your blood work, hidden in all the other aspects. But okay, and you would have seen somebody with the most vague symptoms and they might have it, right?
Exactly. Very vague, like loss of appetite, loss of weight. They'll be thinking they're losing weight because they're working out, exercising. You don't know.
Oh my God. So could you tell me, how do you cure this, the TB of spine, for example?
Luckily, all that you have to do is follow the regimen, ADT regimen,
Okay.
anti-tuberculous regimen, 9 months properly. Don't miss out on the drugs. And if it's in the spine, then we have to see if there's any instability or any damage to the bones. If there's instability, we have to put some screws and fix this.
Okay. So yeah, I was going to come to that.
Yes.
I was going to say, okay, beyond the drugs, when do we have to go and intervene?
That only after you have to go see a doctor. He only has to advise you. So provided that's TB of the hip, that can result in TB arthritis, then
my
you
God.
might need a hip replacement.
Okay. And coming back to hip replacement and any degenerative disease going towards the hip joints and all of that, could you just give a few alarming signals, like where someone would need to actually take this a little serious and start checking, whether they're prone for arthritis in the hips? What would be the alarming signs? Like from what I knew, I mean, not just I heard after COVID, a lot of youngsters got AVN.
As we discussed, yes.
And they said it just started with groin pain, tight groin. Could you give some examples?
As you said, pain. It's going to start with pain,
Okay.
and the pain is going to get gradually worse and worse, where you are in pain all the time. You're sitting, you're having pain. You're sitting and getting up, you're in pain.
Okay.
Sometimes the first sign will be when you're getting into a car, you're having pain. Getting into a car, out of the car, it starts pain with that. Pain starts with that, and slowly you have pain in all activities. You have pain while walking, even when you're not doing anything, just sitting down, you're having pain. You're limping, and then the pain progresses to a limp. So you're walking with the limp. Others notice you and start saying, "Yeah, you're walking. There's something wrong with you walking." So these are some of the symptoms
And
of hip pain.
hip
yeah.
pain, right? And is it possible that some people, as they get used to this kind of pain, they ignore it and then they get a slight threshold?
Don't
Not
worry.
possible.
How much ever you ignore it,
Yeah.
you'll be limping. Others will notice it.
Okay.
Yeah.
Got it.
Even if you ignore the pain, others will see something's wrong with you. Your gait has changed. The way you walk has changed.
Okay.
Yeah.
So yeah, you must have seen a lot of patients. Actually, the caretakers or their attendants or the relatives will actually bring them over and say,
Exactly,
now
exactly,
off late
yes.
they're not walking, she's not listening,
Yes.
she's not able to sit, but she's ignoring it.
Exactly.
You would see more of that than the person coming themselves, right?
Yes.
Why do you say that?
Some people, they try to ignore themselves. They don't want to fend for themselves. They say, "I'm fine." Maybe fear of doctors, fear of if I go to a doctor, they'll say I want surgery. They have
Yeah.
fear of surgeries.
Yeah.
Those things.
How do we debunk this? Like, how do we make it like? How do we give better awareness where you don't have to be worried about a surgery or if that's going to be suggested? Because this is the biggest fear everyone has. Then I've seen what will happen is they'll go there, they might actually need it, then they'll say, wait, I'll go and talk to this guy. Then they'll talk to another doctor. Then they talk to another doctor. But what happens in this
cure
process?
without surgery? Yeah.
This process, the longer you delay and delay, maybe you're lucky it's orthopedics because you can get away with some time. But other things, this is a very common problem doctors and patients have. Since you're in the younger bracket now, right? You're seeing the trends. What would be a good message you could give away for this?
I think the best person you have talked with is anesthetist. So now there's a lot of advances in pain management, advances in anesthesia, where you have great drugs which can make you actually pain free. You won't feel anything during the surgery with proper nerve blocks. So even after surgery, you are completely pain free. So that can, people who are afraid of a surgery because of the pain, you don't have to worry. There are a lot of advances in pain management and pain medications. And if pain is your only fear, you don't have to worry anymore.
Okay. So
but some people just have a fear of surgery. They don't want to go under the knife. That you have to.
Yeah, you have to come over.
Yeah, you have to get over it.
So that's good that you talked about pain, because that is actually the primary. So now I wanted to ask you. You don't seem to be a big fan of supplements in general. Okay, so
I won't say that. It depends.
I just want to know what would be, like you say, supplement threshold. What are the benefits, risks, and what would you say you need to consult with a physician instead of self-prescribing for over-the-counter drugs, like ones which are not necessary for prescription, right? Would you say still you would need to see a physician and then go ahead with that? And do you feel there's any benefit to it? Along with sports activity?
I won't say I'm not a big fan. I do take supplements. Personally, I take a lot of whey proteins. I like caseins. What I say is nature is always the best. Always try to get it naturally from natural food sources. Of course, when you are working out, when you are into sports performance, when you want to increase your performance, you need to supplement yourself. You get it in the name itself, supplement. A supplement should be a supplement. It should not be the main food. What mistake most of us do is we make the supplement into our main food and we avoid our main food. Most of us have done. Even I've done it in some periods of time. Then I realized, what am I doing? I'm just using the supplement as main food and I don't have any main food at all. So a supplement should be supplementing your normal balanced diet. So always get a normal balanced diet, which is a lot of green leafy vegetables and high proteins, even carbohydrates, fats. The three major food sources: fat, protein, and carbohydrates. Don't try to omit any of this. Now it's become a trend. Going on the Atkins diet, going on a carb-free diet, going on a keto diet. Don't try to eliminate any source of, any macronutrient. These maybe the macronutrient that you can avoid is alcohol. Alcohol is another macronutrient. You can avoid that. If you want to avoid any macronutrient. So supplement you can take whey, you can take casein, you can take pre-workouts, but what I try to say is don't use pre-workout every day. Don't make it a habit, because pre-workout and does contain a high amount of caffeine, and if you are used to taking pre-workout each time you go to the gym, there is a very, very high chance that you get addicted to caffeine. So then you cannot live without caffeine. You can't live without pre-workout. That's not fair. So make it like take pre-workouts on your off days when you don't feel like going to the gym, when you're feeling very low. Maybe it doesn't happen every day. Maybe you work out 5 times a week. 2 times a week you're going to feel that. On those days, take a pre-workouts. So don't take pre-workouts every day.
Okay, I'm guilty to that.
I know. I was also guilty to that, and I found out I'm doing something wrong, and I'm slowly changing that.
Okay. It's good. And there was actually when we're talking about this, there was a small study which I had read about, and I've also seen this happen with me itself. So I'm going to ask you this doubt. When you do very, very intense exercise for probably a week, right? Like I'm saying, very high level activity, like soccer, boxing, and then after that weightlifting, heavy weights. Is it possible when you take a blood test just after a heavy day, there's a slight dip in your calcium? Have you heard of this thing, or this is something you've not heard of?
Actually, I haven't heard.
Not heard of that.
No.
Okay. Over extremely strenuous exercise, one slight dip of calcium.
After extremely strenuous exercise, what can happen is sometimes your creatinine values might go up.
They will
go up. But calcium dip is something new to me. I haven't.
Okay.
But why do you want to see your calcium?
I don't know, when you do one general blood test, and then I was like, okay, then I read it.
Maybe it's possible. I haven't heard of this. It's new to me.
So I did a read up on that, and then they said you'll have a transient dip, and then after the recovery,
it will go up.
And another thing, what I think, I don't know if it's right, does caffeine have an effect on calcium absorption?
Yeah. So too much of caffeine can interfere with absorption. You are fine with 4 cups of coffee a day. Don't go beyond that. There are some people who have 8 cups. So 1 cup of coffee generally has about 80 milligrams of caffeine. So you're fine with about 300 grams of caffeine.
Okay.
And you should also take into account your pre-workout. Pre-workout or any of the fat burners or any supplements that you use. So 300 to 400 grams of caffeine per day is admissible. Anything beyond that can interfere with calcium absorption and also interfere with your
iron also.
Yeah.
Perfect. That was good actually. So people will think about that aspect also.
Yes.
So okay, now coming to that, would you say you can take calcium supplements? Now I because a lot of people I know they do in sports. I'm saying, not in like proper athletes. And I have a doubt. Now if you need, they'd say this. Suppose there's a match coming up for somebody or there's some intense requirement. They say, sir, I started taking calcium supplement, Shell Cal 500 every day for 1 or 2 months. Now what is the threshold for that? Do we take it in a year for intense training? Do we take it like throughout the year, or should we just take it as a burst like 3 months in a year or alternate weeks? What would you suggest?
Again, I prefer always the getting calcium from the food. So, but there are some people who don't take milk. They avoiding milk, avoiding dairy products. In those cases, when they are going through a very strenuous workout, it is advisable to take calcium about 500 to 1000 grams a day. Don't take it throughout the year. 3 to 4 months a year.
3 to 4
take
months.
Take it for about 8 weeks. Give it a gap, and then 8 weeks. On and off, yes.
Because I think this can cause kidney stones and some other things.
Yes. When you overdo it, it can do that. Yes.
Could it also interfere with your arteries in the heart and all of that? Like, is it
not at the low dosage? When you exceed the dosage, when more than 1000 grams a day, and do that, then you can do it.
But there are people who don't know, right? And then they would be like, more is better.
No, more is not better. More is definitely not better.
All right. It's a very basic thing, and probably we would know. We'd have an idea of the science behind it, but this question came up from some people. They're like, why do your joints crack when you open them, stretch them, whatever? What is the...
So usually after a long period of immobility, when you move your joints, the nitrogen bubbles come out and they burst in the synovial fluid. So that can cause your joints to crack, a cracking sound. Most of the time it's harmless, but some people, they're so used to keep on doing it, it becomes like a habit, like an obsessive obsession. So that is not advisable. Don't keep on cracking your joint.
Why would you say that?
Repeated cracking, putting pressure on the joints, that can cause osteoarthritis.
It can, right?
It can. Repeatedly. Once in a while, you see, you have your joint, you have immobilized the joint for a long time. After a long time, then stretching the joints, then it can crack. But if you keep on, some people, they do it in the neck. They keep on cracking the joints and they say, I get relief only from that. Those people should beware. They don't do that. And instead of doing this, take frequent breaks, half an hour, 45 minutes, take a break and stretch the neck, stretch the ligaments so that this cracking doesn't happen.
Okay, talking about that, I'm going to go to the next topic, which is related to this cracking. You've heard of physiotherapists, you've heard of, all other allied, sciences with this, but chiropractors, I'm scared because the noise is like one extreme. And then you'll be seeing some memes and some funny things, but at the same time, it works for a lot of people also. But can you tell me something about chiropractors? Because I have really
chiropractic is actually a kind of an alternative medicine that was actually originated from the United States of America, US, and they have a proper chiropractic association where they give a degree. So anybody cannot become a chiropractor. You have to have an undergraduate degree, and then you have to do the chiropractic college, and get a degree from the chiropractors, and then they have to get a chiropractor's license to practice as a chiropractor. But now in India, almost everybody who does online, who sees online stuff, social media stuff, and doing this, they're calling themselves as chiropractors. So what exactly chiropractic is where it's a medical form where they make the body to heal itself. That's the basis of chiropractic, and the emphasis is on manual massages, manual therapy, and massaging the spine. Of the spine. So if done in the proper way, it doesn't work for all conditions. Some conditions where there are knots in the muscles, where they have some muscle tightness and muscle sprains or spasm of the muscles. In these conditions, they do work. But you cannot be using a chiropractic to treat a disc prolapse. You cannot be using it to treat TB of the spine. You have back pain, that might be even tuberculosis of the spine. There may be even bone lesions.
That's dangerous.
So you can't be using chiropractic to treat that. So when treated for the right condition, it does work, but you need to know where to put a full stop to it.
So I'd say first we'll go to the orthopedic surgeon, take an X-ray, get your MRI done, then decide whether you want to go to a chiropractor or somebody else with their permission. Be safer, right? Because if you have something else, and then you go and do it, it can become a disaster.
If you're already having a slipped vertebra, we call it spondylolisthesis. If you're going to put manual pressure on that and you're going to further slip the vertebra, it's not going to work for you. Yeah.
So that's a good takeaway from this. Now, there was another thing, talking about alternative medicine, that is in the US. Here, I don't know if I can bring this up, but I have to. Puttur Kattu. What is your take on that? We have to, you have to tell what's right, what's wrong. And I think it's our basic duty from what education we've had to actually give the right guidance. So some people totally believe in it, by the way. I don't have any idea about it. So I wanted yours.
See, basically, Puttur Kattu, they do it for fractures. You have a fracture, you go to Puttur Kattu, get it done. But the basic concept of a fracture is, if there is a fracture, immobilize one joint above and one joint below. That's for about 6 to 8 weeks. The fracture will heal.
Okay.
Put the fracture in proper alignment, the fracture will heal. Okay. So we also, for many fractures, we put what we call POP, plaster of Paris, the Maavu Kattu, we do that.
Okay.
So
same thing. Okay.
Yeah. So if the fracture is undisplaced, if there is no comminution, if there's no intra-articular extension, a Puttur Kattu is well enough. It will heal. The fracture is going to heal.
This is a good answer.
But if there's a lot of displacement, if there is intra-articular extension, if there's a lot of comminution, then a fracture is not going to heal with just a kattu. Be it a Maavu Kattu or be it a Puttur Kattu, you're going to need some more. You're going to need a fixation, an internal fixation. If there's an open fracture where a bone is exposed and there is a lot of dirt inside, you need a wound debridement, you need to fix the bone, you need to completely clean the bone, you need to probably put an Elisarov or an X-fix. In those cases, Puttur Kattu is not going to help you. So there are certain cases where it will help you, certain cases where it will not help you. Yeah, but now I'm seeing ACL tear, I will cure you. There's a Puttur Kattu they're saying. Frozen shoulder, you get a Puttur Kattu. That's not going to work. In specific certain sets of fractures, it will work.
It's a good answer what you given. It's not just biased and
we do that. We call Maavu Kattu. We are going to put a Maavu Kattu. It's almost the same thing what they are doing. We're going to put the fracture in alignment. We're going to put a POP, immobilize the one joint above, one joint below for about 6 to 8 weeks, and then afterwards take an X-ray. The bone is going to get healed and make them walk.
What do you think? Some very basic and important stretches. What you want somebody to advocate in workout regime or whatever. Now this question has come from a lot of people, so you can give your own version of the answer for it. If you, instead of saying, sometimes even I don't want to give it, but you gave a very brilliant answer with Puttur Kattu. I like that because you're not saying no, this is bad. You're not debunking somebody's actual hard work, what they've done. So that way, what would you say? Like, actually, how important are stretches? Like, how important are they?
Yeah, stretches do play a major role in preventing injuries. Especially you stretch before the workout and also after the workout. It depends on which body part you're working on, especially in weightlifting. So you're going to do biceps. You need to stretch the biceps muscles, the triceps, and your shoulders. You're going to do shoulders. Stretch the shoulder parts, and especially in squats, you're going to do squats. You're going to do leg day. You need to at least do some basic stretches for your hamstrings, so you don't injure them while working out.
Okay. So it's
you
just
want me
basic.
to demonstrate,
No.
You know what I mean?
I wanted to ask one more thing. I've seen even from my father to a lot of people in orthopedics, right? I've seen at least 95% of them are into fitness. Have you ever thought about why that's the case?
Maybe in my case, I chose orthopedics because I love fitness.
How is it interlinked?
I don't know.
Yeah, see,
maybe people who are into fitness, they take up orthopedics. Or maybe
I'm going to ask you the question why.
I like a lot of sports and I'm seeing sports injuries, so I wanted to treat those people with sports injuries. Maybe that's why all orthos who are into sports or dealing with sports injuries, they take up orthopedics. I don't know.
Okay, that is the closest answer we came to.
But we have some gynecs also who are into fitness, right?
Lots of gynecs. Alright. So is there anything you'd like to convey? Like, you out of all your practice right now, and I mean, what I have also witnessed, when we're running hospital, clinic, everything, is that I feel people should have some content somewhere with one doctor, at least see one opinion and then come back. How do this is my perspective, and then you go into like 3 different doctors, and then you suddenly don't, they'll almost book the date for some procedure, then they just go somewhere else, whatever. But in the end of the day, we want them to get better. That's important, right? What would you say to put them at ease? Like, is it because of too much information this is happening, which is sometimes a good thing for them, for patients, or is there too much doubt because of negative media about doctors? Where do you find this?
I think there's nothing wrong in patients getting a second opinion, even a third opinion, but maybe you go get opinions, and until you find the right guy who you think might be able to help you, I don't think there's nothing wrong. I won't blame the patients.
Yes.
If I was a patient also, I will be getting opinions.
Yes,
but and then finally, if I think the first doctor is right, I feel he himself is better, I'll go back to the first doctor. Same thing I think with the patients as well. So get a second. I've seen so many patients. They come to me. I've told them surgery. Then they've seen 2 doctors, 3 doctors, and finally they'll come back to me for the surgery. So it's not the patient's fault. It's our human mindset, I think. We want to see what's out there. I mean, there's so much of opportunities now. There's so much of doctors now. We say India is a developing country, but I think as far as healthcare is concerned, especially in the cities like Chennai, Bangalore, Hyderabad, healthcare is amazing. We have access to the best specialists in the world, which even Americans, Australians, UK people don't have. They have a waiting. If they want to see a specialist, they have to wait for 6 months.
Exactly.
Here, 6 minutes, you can see a specialist. You can get a video call. Some specialists near you, highly qualified specialists, even who has done MCH fellowships. So when you have that, make use of it. So get a second opinion, get a third opinion, and it's up to the patient to decide who they want to get operated by.
That's
I won't blame them.
That's really good.
Yeah.
So, I mean, in our final takeaway, what is the recent trend you've seen in your field or in medicine in general? How do you feel people are receptive now? Are they receptive to new doctors, or do they still have the faith only about one person, or are they having an open mind to others?
Now I think they are very open-minded. They Google a lot. Before coming to me, they see all my reviews. They Google about the conditions. I mean, people come to me with the diagnosis most of the time, and 80% of the time the diagnosis is right.
It is. That's true.
It is right. Yeah. So I have to give it to them. Yeah. But sometimes it's crap. It's totally. I had one patient 2 days back. They said, "Doctor, I think I have cancer, bone cancer."
Okay.
It was nothing, not even just general muscle spasm.
Oh my God.
Everything was normal. But I think I have cancer. Please check me. So there are some patients like that. But most of the time, they do their homework. They look up their symptoms. They come to a diagnosis. So sometimes it
helps you also.
It helps me. Yeah, it makes my job easier also.
Perfect. Okay. So thanks a lot, Dinesh, for your time. It was.
Thank you for having me. It was a pleasure.
Anytime, and we'll do it again. We'll call some more people over.
Yeah, sure. We'll do that.
Thanks a lot.
Thank you.
Thanks.